Hello, this is Krishna Sorga. This is my video diary 2, where I am discussing the questions. I'm going to read the questions and then answer them based on the case study today. And this is for Comp 3323 for health organizations. And then I'll go ahead and get started. For number 1, how would you describe the communication that occurred between the provider and the patient? I would definitely describe it as a lack of communication. I feel like it was one-sided. It was the provider mostly speaking, interrupting the patient. For instance, when she starts talking about her issues, she starts talking about pain, and the provider interrupted her. I feel like there was a lack of, the patient socialization where that she would be able to explain her feelings and how it affects her activities. Basically, the life world versus medicine. She wasn't able to give her perspective. For number 2, how did the provider's interruption of the patient's communication contribute to or detract from the provider's information gathering? It keeps the patient from talking about their experience, their narrative. Their narrative is important. Most patients are able to explain what is going on with them through that storytelling, which is full of information. And I feel like the provider did not let that happen at all. What about the goals? What is the patient's goals? What is the doctor's goals? I feel like this patient felt disregarded because not all concerns were addressed. Okay, so for number 3, what did the students learn about communicating with the patient from this example? How the wrong way to communicate with your patient. The students are learning that based on the provider, based on this scenario where the provider is interrupting the patient is okay. That the provider needs to take control of the conversation. There was no attentive or respect towards the patient. The students were learning how to take control of the conversation based on what the doctor showed them. For number 4, describe how the provider's nonverbal behavior communicated his or her status and role. What specific examples support your observations? This provider, the nonverbal behaviors communicated was standing up. The provider was standing up. The patient was sitting down. That shows that superior status. I'm the doctor and you're the patient, so I'm going to tell you how to be treated. That's that type of communication between the doctor and the patient, where the doctor is the one doing the treatment and not involving the patient. The interrupting the patient was the provider kept interrupting the patient when they were speaking. What was the rest of that conversation going to be? And also correcting. When the patient corrected when the provider corrected the patient saying, do you have any vomiting? Do you have any diarrhea? The patient says, I have diarrhea. Okay, well, how many stools are you having a day? Corrected her. The provider corrected her, saying, "Oh, well, we call that loose stools, not diarrhea." Okay, and then for number 5, describe how, what verbal communication from the patient would you like to have expanded? There is quite a bit, wasn't there? For the nonverbal behavior, the patient said, "I hope you can help. I hope I can feel better." Those are red flags. Something's going on. She says, "There's pain in my side," and the provider interrupted. What was the other thing? What was the patient going to say? She's had a rough week and was interrupted. Why was it a rough week? What's going on at home? But maybe when she was talking about pain, her rate of pain, what was the but maybe? When she starts talking about if she's going to need surgery, I feel like she got concerned and worried. I feel like she needs to be put at ease. For number 6 says, what verbal communication from the provider would you like to change? Respecting the patient a little bit more, being able to let the patient speak freely, let them narrate what's going on with them, so that way you can get an understanding of how they feel about what's going on with them. Not to correct the patient. I mean, you really don't have to tell the patient, well, that we consider that loose stools and not diarrhea. You could say it in a different way. And ask, are you okay? Are you okay? What's going on? That verbal communication, I felt there was a lack of it for the patient. For number 7, it says, identify 3 or 4 behaviors, verbal and nonverbal, that would help to enhance an interpersonal relationship between the provider and the patient. I would definitely, nonverbal, I would definitely include the patient in their treatment plan. What's going to happen? What is the doctor gonna do for the patient, and what is the patient gonna do to help? Definitely sitting down, eye level makes a difference. When you're having a communicational relationship with each other, being eye level shows that you're listening, that you are not standing over them, you're not standing underneath them. That makes a big difference. Not interrupting. Don't interrupt the patient constantly. The provider interrupting the patient, it could have been something very important that patient was discussing. Was maybe they have more than one problem that's going on. How is that affecting them right now? How does it make them feel? What about those other concerns? Is it affecting their mentality, their psychological concerns? For number 8, why is an interpersonal relationship important to provider-patient interactions? That is very important because the patient is putting their lives and health in the provider's hands. For proper communication to happen, you have to be able to collaborate with each other. Provider and patients need to not feel concerned, need to feel safe. The patient needs to be able to depend on the provider to give them care and to have that satisfaction of my health is we're getting somewhere. We're getting somewhere with my health, and my provider is listening to me and including me into my treatment. I believe that's all I wanted to address today. I didn't. Okay, well, that concludes my answers. I hope this was clear and understood. Again, this is Kris-TEN. Thank you very much.